across the world, across the fields, across all sorts of life, across our communities. As an engaged university, I can proudly say that we have been able to observe this practically as we do our engaged work with the colleagues as well as our communities. So we have seen what it has done to our communities, and we can see how difficult it is for us to move forward. I would like, therefore, to introduce this webinar as the webinar that is going to give us the level of the impact as well as the solutions and strategies for us to move forward after the COVID-19. There is an article that was circulated to us this morning by one of our professors in community engagement. We can see Professor Letindama for us. This article is an international article on surveys to introduce that are indicating very clearly that even researchers are not as productive as level of the impact. We do know that we had a year that was a shutdown for us, 2020, and therefore this impact has also influenced how we therefore get to the solutions and how we therefore understand the landscape. So today is one of the best days for an international as well as our colleagues and other universities that have joined us, including the ministry. I'm so grateful to the MBC for joining us, because we do know that we hear and learn from our colleagues. How do we move forward? How do we become resilient? How do we attain grit so that we can be able to survive this pandemic and be able to live after and be able to educate the coming generation when they reach a space like the one we have reached at this moment? Thank you so much, colleagues. I'm not going to waste your time. Over to you, Program Director. Thank you.
Thank you so much, Professor Favor, for sharing with us the purpose of the session. Colleagues, without any further waste of time, let me now invite the Executive Dean of the Faculty of Humanities, Social Sciences and Education, Professor Bongani Bantwini, to share with us the remarks from the faculty. Professor Bantwini, over to you.
Thank you very much, Program Director, Dr. Zaga, the Vice Chancellor and Principal of the University of Venda, Dr. Ntambeleni, the MEC for Health in the Limpopo Province, Dr. Ramatuba, members of the Limpopo Province Health Department who are here,
to share
our
with
DVC
us,
Teaching and Learning, Prof. Crawford, our DVC Research and Postgraduate Studies, Professor Feza, all the faculty executive deans that are here with us this morning, Professor Mokalaka, Professor Mlauti, and Professor Kanyane, our honorable speakers and presenters in this event today, the Registrar for the South African Council for Social Services Professions, Mrs. Malamba, the Association of South African Social Work Education Institutions, our distinguished guests and dignitaries, University of Venda academic community, colleagues in the Department of Social Work, our Univen students, ladies and gentlemen. On behalf of the Faculty of Humanities, Social Sciences and Education, I greet you all and also would like to welcome you to this webinar. We have just heard about the purpose of this webinar from our DVC Research and Postgraduate Studies Professor. As the Faculty of Humanities, Social Sciences and Education, this webinar is one of the most significant and critical webinars we've had this year. Among the many reasons for that, it is that it is there is a strong developing consensus amongst us that COVID-19 pandemic is real and it has indeed severely disrupted our normal lives. So we continue to witness the psychological and social effects on our population. And sadly to say, most of the research conducted thus far has focused on the medical side, and of course with the hope of getting the cure, but however, neglected the other crucial factors resulting from COVID-19. Recently, we have noticed small pockets of research highlighting the impact on psychological well-being of the most exposed groups, which includes, among many, our university students, who are more likely to develop post-traumatic stress disorder, anxiety, depression, and other symptoms of distress. So as the faculty, we are of the view that the development and the promotion of psychological interventions on the specific population who's more likely to develop pathologies and suffering is needed. We believe and hope that all the presentations that will be made today and all the deliberations and recommendations that will emerge from this webinar will assist us to collectively find ways to mitigate the impact of this pandemic and rebuild and restore our society. As a university, we deem it part of our social responsibility to establish and promote psychosocial services and address economic implications to the affected and infected of COVID-19. Nevertheless, the task alone is tantamount. The success lies on our strong collaborative approach. Our success depends on a multidisciplinary network approach. We believe that this engagement will lead to a strong collaborative, fruitful, and a beneficial research imperative among various stakeholders. In line with this is our institutional value, one which underscores social responsibility and community engagement in serving and contributing to intellectual, social, and economic well-being of our communities. So this webinar, it also intends to advocate for student social workers to become an essential workforce during this COVID-19. We believe that there is an urgent and a great need for research in our communities to identify various interventions and solutions to some of the challenges resulting from COVID-19, including the scourge of the gender-based violence, child abuse, severe poverty, among many. Our faculty believes that there is a need for research to identify and reinforce community resilience. There's a need for research relating to how people are coping during this COVID-19 period. So we need responsive activities, and as an institution of higher learning, we view our role as that of training our students to be innovative to address the new normal in the community. To influence, we also view our role as that of influencing our policies to ensure that they address and advance the needs of our community. As previously mentioned, we need all the stakeholders and various government ministries to work hand in hand with us in assisting our societies in their challenge as a reactive activity to the scourge of this pandemic. So this webinar is one of the many that the Faculty of Humanities, Social Sciences and Education is planning to have. And our program director, with those few words, I wish to thank you for this opportunity and everyone for their presence in this webinar. We look forward to a persuasive presentations as well as engagement. And thank you.
Thank you so much, Professor Bantini, the Executive Dean of the Faculty of Humanities, Sciences and Education. Colleagues, let me now invite the Head of Social Work Department, Dr. William Mkhorosi, to share with us departmental remarks. Professor Dr. Mkhorosi, over to you.
Dr. Mokgweetsi, please unmute yourself.
All right. Yes, I was just saying, morning. I was just indicating that I was disconnected and then I missed certain things. I hope you can hear me now. Dr. Zaka, thank you, the chairperson of the day. On behalf of the Department of Social Work, we wish to extend our greetings to you all with the words of gratitude going to our invited guests, starting with our MEC, Dr. Ramatoba, and also thanks to the principal, Dr. Ntabeleni, and the senior management team, and our executive dean, Dr. Bantwini, the outgoing School of Human and Social Sciences, Dr. Mahopa, Department of Social Work staff and students, and also special word goes to our organizing team, Dr. Matseya, Dr. Mangani, Dr. Mamaleka in the department. Also, the words of gratitude must go to the principal's office, media office, and marketing, IT, and the dean's office. Department of Social Work currently at University of Venda offers 2 programs, bachelor's and master's degree, and we hope to offer a doctoral degree soon. I won't get into purpose of the webinar in the interest of time because all that has been covered. Safe to say, currently South Africa, according to the available numbers, that South Africa has suffered at almost up close to 90,000 deaths and counting, and that globally the last number that I'm aware of was 4.5 million people since last year. This pandemic has exposed psychosocial and economic fault line in our society and all other societies at risk, and all people at risk. Let me just get back to it about people at risk. Charles Darwin, almost two lifetimes ago in the 19th century, said the following: if the misery of the poor be caused not by the loss of nature, but by our institution, great is our sin. I'm saying that because currently now, because of this pandemic, we're beginning to get exposed to the fact that there are lots of people in our society that are suffering that we have not been paying attention to, not necessarily because of COVID, but because of all other things that we have not done as a society. For example, young people in our society, I'm talking about the youth, 15 to 35, some numbers from SSA will say 4 to 5 million, other people, researchers, and Bernstein and others will put it as high as 9 million. That these young people are facing a conundrum. They are not in education, training, or any other place. So these people, most of these young people have not completed their high school so that they can proceed with their lives of training and education. And then they can't go back and finish that because back there in high schools and those kinds of places, they are told that they are old to go back to school. So our country, for example, is faced with that conundrum. So I'm saying beyond our discussion today of focusing on COVID, we still have other social ills that we have to pay attention to say, we're talking about this, but let's not forget the common one. Other speakers have already discussed GBV, substance abuse, and all those things. Let me get finally to my other job, which is to introduce our panelists for the day. My job here is restricted to just introducing the panelists. Because I was disconnected, I don't know what else was said earlier. But the panelists that we have today, we are greatly honored as a department, as a faculty, and as a university that the following people agreed and they are participating in our discussion of the day. In no particular order, we have Dr. Bila from Department of Social Work and Criminology, University of Pretoria, who will be talking about the pandemic and its impact on socio-economic and mental health. Then we have Ms. Lorraine Bam from University of Cape Town, who will be talking about people with disability and COVID. Her focus will be looking at how this thing has an impact on people with disabilities. Then we have Professor Pulen Sekhalov, the Chief Albert Luthuli Research Chair at UNISA, who will be talking about undoing age-old traditions in relation to COVID and the psychosocial disequilibrium. Then we have Mr. Victor Mabindula, a provincial manager of Human Rights Commission in Limpopo, who will be talking about the impact of COVID-19 and enjoyment of its impact on the enjoyment of human rights. And then also we have the last presenter in no particular order, I said, Ms. Langi Malamba, the Registrar for South African Council for Social Service Professions, who will be talking about the state of community mental health and its impact on post-COVID situation, PTSD experiences. And then in conclusion, Mr. Chairperson and people who are in the audience and everybody else, we hope that the presentations of today will enrich our experience and also influence how we begin to deal with this pandemic and other things. Just like somebody said in the past or at some stage, that we cannot keep using current keys to open modern doors. That perhaps our panelists will assist us to alert us to say, this is the situation that faces us now going into the future. What do we need to look at in order for us to be able to deal with this thing? With these few words, Mr. Chairperson, the Department of Social Work has created, in the faculty and the university, has created this platform for further discussion and information sharing. We hope our panelists will share with us their understanding from their professional and work experience, so that we can have a better and clearer understanding of how we deal with these things as we go into the future. This is our humble contribution this year to community engagement and scholarship. Mr. Chairperson, Dr. Zaga, thank you very much.
Thank you so much, Dr. Mporosi, for the remarks from the Department of Social Work and for also introducing panelists. Colleagues, as indicated earlier on that there are some adjustments on the program, let me now take this opportunity and invite our Vice Chancellor and Principal, Dr. Bernard Ntambeleni, to introduce our keynote speaker. Dr. Ntambeleni, over to you.
Thank you, Dr. Zaga. Ladies and gentlemen, it is my pleasure to introduce to you our keynote speaker this morning. Our keynote speaker needs no introduction due to the work that she has really done in a very short space of time that we became aware of him. Dr. Popira Matuba is a member of the Executive Council for Limpopo Provincial Department of Health. She obtained her MBCHB degree from Sifako Makato University, Health Science University, formerly known as the Medical University of South Africa. She also holds a master's degree in medical pharmacology from the University of Pretoria and advanced health management from Manchester Business School. While at the university, Dr. Ramatuba became a branch executive committee member of the South African Student Congress and later a provisional committee member. She also served as a general secretary of the Student Representative Council and also its deputy president. Dr. Ramatuba served in the interim leadership core of the Young Communist League, which led to the relaunch of the Young Communist League nationally. She is the founding member of the South African Medical Association Trade Union and also served in the board of the South African Medical Association and as a national chair for public service doctors. Later in her career, she held a position of the chief executive officer at the Voortrekker Hospital. She was also elected as the president of the South African Medical Association and a treasurer general of the Commonwealth Medical Association. She served in the Central Executive Committee of the Congress of the South African Trade Unions. She received several awards, which include the Premier Service Excellent Award in 2015. As a member of the National African Congress, she took part in the relaunching of the branches in the Waterberg region and became part of the African National Congress branch executive in Mogalakwena municipality. She served in the Regional Executive Committee of the ANC in the Waterberg until elected to the Provisional Executive Committee. She is currently the Provisional Treasurer of the South African Communist Party in Limpopo Province. Ladies and gentlemen, please join me as we welcome Dr. Phophi Ramathuba. Thank you so much.
Good morning, and thank you very much, Prof, our Vice Chancellor and Principal, Professor Ntambile, the entire leadership from the University of Venda. I'm afraid of singling out individuals, but to start with the Executive Dean and the entire collective that has made it possible for us to find ourselves in here, and also extend from warm greetings from the Limpopo government to, I hear, a number of academics that have joined us from different institutions of higher learning. We really appreciate that as the province and as a provincial government, and also to our students and the entire community and members of society that have heeded the call of your invitation and joined this particular webinar, which is very, very critical. I must appreciate this initiative, Prof. Ntambile and your team, to say we really appreciate this, because as government, there is in no way that we will be able to execute our duties unless institutions of higher learning, who are the ones who hold the wealth of knowledge and understanding, because for you, it's all about research and it's all about evidence-based. That is why if we do not work with, hand in hand with you, and we do not rely on you for information, we are going to end up using common sense to lead this country. And common sense has shown us in many aspects that if you want to lead utilizing common sense, you're not going to achieve the desired results that we all want to achieve. So we want to really appreciate. There could never be any best institution except the institution of higher learning to lead us even this time of this particular pandemic, because we're no longer dealing about COVID-19 as a pandemic on its own, but we're dealing with its impact, and mostly on the socio-economic issues and psychosocial issues and mental health. Its impact on mental health, we have seen that it is really causing a lot of problems out there. So we want to really start by expressing our appreciation for in this particular invitation by this university, and also to say I also bring a warm and revolutionary greetings from the Premier and the Limpopo government. As you know, that he has delegated me because of a number of pressing matters that he is currently attending to. So for me, of course, it was exciting to find myself being here, because the topic, it's very close to my heart. It's things that we deal with on a day-to-day basis. You are quite correct, Prof, and many speakers that have spoken before me, and I know even those that will be coming to speak after me, they are going to emphasize on the matter of even our economy is struggling to recover from the grip of the global coronavirus pandemic. If we remember when we had the first case of coronavirus. It's almost 2 years now. In the next few months, we will be having 2 years. We would not have known, because it was a novel virus, that the magnitude of what was to come. At first, it was a Chinese virus to many people, and it was just, it's very far. It will never get to me. If I'm staying at Hachikunda Marema, I've got nothing to do with this. But we have now seen what it has done over this almost 19 to 20 months, what that our community have been left devastated. At that time, we would not have imagined that this virus would force us to even shut down our places of worship. We never thought that factories were going to be closed. We never thought we'll shut down the doors of learning and our culture and effectively bring our economy to a standstill. Nothing would have prepared us for such a radical change in our way of doing things. Indeed, the history of the world will never be divided, will forever be divided into two chapters, where you are going to have the chapter before COVID-19 and the chapter after COVID-19. And nothing will ever be the same again. This includes how we are going to do business as government and also as the private sector and our academic institution. I know, as a matter of fact, as universities, you had to adapt and adjust the way of doing your day-to-day business, how you were teaching your students, how you had to introduce innovative way, and we were forced as a country and as a nation globally to quickly move into the fourth IR, to quickly start to come with innovative way of getting technology to assist us in many other ways. It has shown us that everything is possible, and as long as people are committed towards doing that. For instance, there are positives when it comes to the manner in which we are running our business today. In the past, we would probably be dependent on, let me give an example of today's engagement. It means I would have driven almost 120 kilometers to come to attend this webinar. And at the same time, at 11:30, I'm expected to be in another engagement. And I'm expected to be in another one at 1:30. There is also an infrastructure cluster that will be there at 3 o'clock. So it means I will not have even been able to do that. The day would have been dedicated towards dealing with this particular webinar, which is very critical and important. But due to the technology that we are currently utilizing and through virtual meeting, I'm able to juggle around and attend to all these commitments. And I think that is one issue that I appreciate the post-COVID era, that we probably can have as many webinars as possible through this virtual engagement. But of course, having said that, the reality is that there are many other negativity that has been brought by this pandemic. We know that the post-traumatic stress disorder that has already been indicated even on our learners, it's something that it will take a lot of time to recover. And we know the economy for our country to recover, it's going to be very difficult. That is why, through the leadership of President Cyril Ramaphosa, we had to quickly come to the National Economic Recovery Plan, that had to be introduced very quickly to try to ignite the economic activity, to restore the investor confidence and prevent further job losses, and to provide a protective net for the vulnerable groups in our society. And Prof, in the essence, this stimulus and recovery plan, it's based on the following, maybe like just to remind colleagues that we firstly are looking at implementation of growth enhancing economic reforms. We are also looking at reprioritization of public spending to support job creation. We are also looking at the establishment of an infrastructure fund and address the urgent and pressing matters, especially the focus being on the social cluster, which is education and health, and also at the same time investing in our municipal infrastructure. And of course, if we are able to deal with that, because it's got direct impact on our social lives that have been disrupted. Many people have lost so many their jobs, and the country currently, we can see that it's bleeding. I'm not sure even if now I will continuously be cut in terms of the network. I'm just hoping that I'm not. That's why I even now switch off my video. Because we are currently experiencing load shedding here in Polokwane, where I am currently. And that it's another a pandemic that we are expecting you as academics to be able to provide a solution to us as government, because it's having serious impact. While we are still saying we are committed into economic recovery, then you are hit by the continuous load shedding that has even gone to stage 4 as you were recovering from the levels of lockdown. It has become a serious problem. And I must indicate that until such time we work jointly and closely together and not use common sense and try to use research, our researchers, and also our researchers focusing mainly on issues, the bread and butter issues that are affecting our people. We've just come out of the local government elections, and some of us who are full-time politicians, we know what our people are raising, whether it's issues of water, whether it's issues of sanitation, whether it's issues of just primary health care. Those are basic issues that we are not requiring a lot of complications to be able to achieve. You know what I always said and share with my colleagues is that
MEC, please unmute yourself. You muted. Thank you.
Oh, thank you. I'm not sure when was I muted. Is it been a long time?
No, MEC, it wasn't.
Okay.
Yes, thank you.
No, thank you. So I was just indicating that our people require basics, the basics, water to drink, because even when I was still a young person, the first thing I learned in my biology was no water, no life. That's what our people are looking for. They are looking for basic health issues. They're looking for food. They're looking for just all those, and it can be achieved if all of us can put our heads together and deal and focus on the priorities. Now, the psychosocial and economic impact of COVID-19, which is one of those topics that really touched my heart and attracted me to be part of this. It's because when you go back, and all of us go back, and look at what the United Nations framework for immediate socio-economic impact on COVID-19 pandemic, the United Nations, that framework has warned all of us. They warned in the early stage of COVID-19, early last year, that this pandemic, it's far much more than just the health, because it's going to affect societies and the economics at their core. And we have seen that happening after being warned. They also warn us that while the impact will vary from one country to another, we must be warned that it's most likely increase and deepen the crisis of poverty and inequality at a very global scale. And they also warn that it will make the achievement of the sustainable developmental goals, if you remember that our SDG of towards 2030, they have meant to be very urgent, because if we all go back to 2015, when we came to an end of the MDGs, the General Assembly of the United Nations adopted 17 SDGs. And if we look at all those SDGs that we were supposed to achieve by 2030, there's been a huge regress because of COVID-19, but also it's telling us that had we prioritized them, and as countries, as nations, had we achieved them, the impact, this social and economic impact of COVID-19 will not have been felt the way it has been felt. Because if you remember, the first SDG was to say, let's deal with hunger and come up with sustainable way of eradicating hunger. Hunger is one of the issue, Prof, that has impacted on and affected our people negatively, especially when you go into the hard lockdown, where government would try to come up with food parcels, but government on its own will not even be able to achieve that. And what worsened the crisis is that the very same few food parcels that government was able to come up with, still, because of corruption and because of the nature of how human beings are, whenever there's something, the selfishness of our inner being, not thinking about the other person, you have found that there were in areas where councillors, public servants were accused of having to take those food parcels to themselves, which really made my heart to bleed, to say, if I'm having a salary, because public servants were worse, we were sitting at home, majority of public servants, but every month collecting a salary. And then still we enlist ourselves to benefit on these 350, these grants that were meant for ordinary people who do not know when their next meal will come from. So SDG number 1 of eradicating hunger, because I'm sure all of us have joined this webinar because we got our breakfast. Those who didn't get breakfast, it's because of their choice. But there are those people who do not know where to get breakfast. And had we eradicated hunger prior COVID-19 pandemic, we will not be in the crisis that we find ourselves. There's issue number 2 was zero poverty. And let's look at what COVID-19 has done. It deepened the crisis of poverty. It deepened the inequality. And for those people, I always say, you go to Camps Bay, you will find that there are people who are staying in those houses, one person owning 15 toilets or bathrooms in their house, because they've got 10 bedrooms. Each bedroom is got its own bathroom, and they've got even other extra bathrooms. But you go to the shacks that are just not far from a stone thrown away, you'll find that the family of 15 and the whole shack compound there, all of them are fighting and struggling for one toilet. We remember the Makaza story and many other stories in our country. And we have seen that is where the inequality is all about. You find me, it's me, my husband, and my son or my daughter. At most, we have got 2 children, but you are sharing with your 2 children and your spouse 15 bathrooms, and you have got the other whole community 15 on average in each household, in each shack, and those 15 families having to share those that one toilet. So those are the inequality and the poverty that we've got to deal with, and we've got to find a way as a nation, and academics must come on board and assist us, because when the next pandemic deal with us, we are still going to have these problems. And there are issues of good health and well-being. SDG number 3 deals with me directly, and you know, a build-up from the MDG towards reduction of maternal and child health under 5 mortality. We have now broadened it to good health and well-being, to say, when are our people going to get primary health care, all our clinics being well equipped? When we put budgets, and our budgets are informed by science, they're informed by evidence on the ground, to say you have to fund primary health care more than you want to fund tertiary and academic. Because in Limpopo, a prof says we did a lot of work in terms of fighting COVID. And the secret was, we went to the basics, deal with primary health care, deal with preventative measures. That is why we were in trouble most of the time with a advocate, Victor Mabidura, I'm sure he's here, human rights, to say, why do you forcefully at times quarantine people? We have done that because that is public health. Evidence is there. Any infectious disease, if you want to eradicate and stop its spread, people who are infected, isolate them. Because basic knowledge was telling us from public health researchers that you will win this battle of COVID-19 if you focus on screening everyone. If you first screen, then test those who are supposed to be tested. While they're waiting for their results, they must be quarantined and isolated. Unlike the young man from Gauteng, when he tested, waiting for his results, he gets into public transport, move from one taxi to another, all the way to Tanin, all the way to Eshebin, started drinking. When Gauteng looks for him to tell him you are positive, he had already spread the virus. It became a felt fire. So that is why we were saying your rights can never be above the rights of other people. This is public health. This is evidence-based. We are going to forcefully isolate you and quarantine you. So if you do that, and then you do tracing, and you test all those who are the contacts, and then you isolate, then that is when you are going to win the battle of COVID-19. We said from the beginning, you're not going to win this battle in ICU. People who must be in ICU, it must have been you have tried your level best, because ICU, it's no return. There are few people who survive once they get there. So that is why we say, if our primary health care, if our preventative healthcare system was strong, COVID-19 exposed us on that to say, when we say prevention is better than cure, when people with diabetes, the lifestyle disease, people with renal failure, people with hypertension, when I look at the 4,000 deaths that we have in our province, majority of them are people who had all these conditions that I'm talking about. And you know, we picked up that we used to think diabetes, hypertensive, it's conditions that will attack you once you turn 55 or 60 and above. We realized that 35-year-olds are diabetic hypertensive. 18-year-olds are diabetic or hypertensive, because when they test positive for COVID, we tested their blood sugar. They were not even aware. So we need more research on that area to say our nation is not a healthy nation. Most of us are walking around here as walking cops, just waiting for a time bomb. And that's what COVID-19 did expose us to that. The rest of them, which it followed after 3, it's equality education, it's gender equality. All speakers who came before me talk about gender-based violence, because we had not put investment on dealing with gender equality issues, so that men and women must understand that we differ in terms of biological, but when it comes to productivity, all of us are the same. I can be a professor, and Professor Ntambeleni can be a professor. Nothing stops us from there. Professor Ndabele can prepare lunch for me. And because when he comes back home, he must not be asking me every day, where is food, where is food? I'm not a restaurant. I'm his spouse, I'm his partner. Teach our boy child how to do that. We did not invest on gender issues because a boy child still sees a woman, a girl child, as something that you can beat up, you can rape, you can do that because they learn from us as parents how we're doing that. So all those issues, if you go through all of them, the affordable and clean energy, I'm talking about load shedding, decent work and economic growth. I've said that if we go and read all those, the reduction of inequality, I've already gone to the peace and justice, strong institutions, partnership to agree. So all of them, 17 as they are, COVID-19 has exposed us as the global community that we need to invest more on them and start working on them because COVID-19 is not the last pandemic. We might still have to deal with other pandemic in future. But if we are to address the SDGs, we'll be able to win. So I'm not gonna be boring you about the current national stats and the death. We all receive them on a daily basis. But we currently must go back and look at how many jobs were lost. We must go and look at how many children are left orphaned. There is currently the research that MRC continue to publish to say we might be having, the last time we checked, we had over 150,000 children being orphans because of COVID-19. That is where we need you, especially as a social work department, as social cluster within the government, to say, how do we then start to go and assist? You know, I was sharing with some of our psychologists when we were launching this psychosocial impact in the department of focusing on our healthcare workers, to say, how do we then assist? Because the difference between HIV and AIDS pandemic and COVID-19, when HIV comes to my house, it was going to infect my husband, who will infect me, and then me and him will die. I'm talking about pre-ARV era, when we were still as government in denial that ARVs have been proven scientifically to can be able to prolong your life, and you can have viral load suppressed, and you cannot even spread the virus at that time, and the virus will not kill you because we would have built your immune system. So at that time, you will see me and my husband will die, but my children will still have got my mother as their grandmother, who will become their foster parent. My children will still have my younger sister, who is their aunt. They will still have my younger brother, who is their uncle, my big brother, who is their uncle. They will still have my aunt and my uncle to look after them. But we still had child-headed families even during that time of HIV and AIDS. Today with COVID-19, the problem there is that I have got friends that I know. The virus infected me and I infected my husband. We both die. When my mother comes to my funeral, she gets infected. 3 days later, my mother died. My younger sister goes to bury her mother. She got infected together with my brother. They both died. Then my other brother goes to bury my youngest sister with the remaining one, the one who died. He also infects, and when he goes home, he infects his wife. His wife also is infecting her parents. That is why families now are broken completely. Clans are finished. This brutality of this virus, we are going to see it now when all settles. Because children do not have grandparents, don't have parents, don't have aunts, don't have uncles. We know in our African culture, extended family doesn't exist. If my sister died, I'll take over her children. But this time around, no one will be there to take care of. So that is why we want you, as the institution of higher learning, to start coming up with evidence-based proposal that can be able to answer. We want you to be innovative and advance as a social cluster, as government, to say, how do we then move forward? Because on our own, we're not going to be able to take care of these children who are left without parents. So we should be able to look at the fact that apart from the physical impact of this pandemic, these serious psychological and social and economic impacts are. And we are always forgetting.
Hello.
Hello.
Kwala henhla ka tafula.
The psychological impact of this pandemic has caused and has got all these adverse events that I've indicated. When people were under hard lockdown, have we ever thought about the impact it's having on our children who could not go out and play? But also for the children to be told you must wear a mask every day at class. These are the things that we need to find a way to say, how do we then recover and go back? Of course, hard lockdowns, we might be angry about them. Some are even saying a hard lockdown has become another pandemic because of the impact of the hard lockdown. But at that time, government had no option except to impose, so that we would have been in the worst situation than what we are, because our health system was not prepared to can deal with huge numbers, volumes of people infected. We had to impose the lockdown so that the system can, within a short space of time, prepare itself to be able to deal with. And also, people are forgetting that when you are like now, if we follow the Department of Transport in the province and community safety, almost every day there will be statements from that department that shows that there's a road accident, so many people died, so many survived. Those people who have died, they still clock the health system because they must go to my mortuaries for postmortems. When you hear my pathologist saying we are busy this weekend, MEC on N1, my tears just go down, because forensic pathologists, it means people are dead there. And when you then, the survivors must also go and clock the system. So that is why you needed to find a way, how do you reduce the clocking down of the system and prepare to deal with COVID-19. But it cannot continue to be like that, because it has been like that to serve the purpose. Right now, when our numbers are very low, it's time that we need to be focusing on recovery. I was sharing with one journalist the other day why he thinks we are forcing people to vaccinate. We're not forcing people to vaccinate, but we're just saying sometimes we are being selfish, because when we're not vaccinated, we're talking about evidence-based. As it is for now, the only medical evidence that I have is the fact that the vaccine is able to reduce hospitalization, it's able to reduce mortality. And I've seen it with my health workers. They survived the third wave. We did not lose any single healthcare worker, whether it's a nurse, whether it's a doctor, whether it's a cleaner, who was vaccinated to COVID-19 in this province. I can guarantee you. But I can tell you, we have lost quite a number of nurses. We've lost a doctor. We've lost some health workers to COVID-19 during the third wave. And immediately when they tell me someone has passed on, I get into the system, because it's for my interest to know and understand. And I can reassure colleagues that they were not vaccinated. Some of them were just vocal anti-vaxxers. It's just, of course, we are government and we are health workers. We health professionals before we even become government. So our ethics, we don't play politics when it comes to health issues. We use ethics. Our ethics will not allow us to go and tell the children of this disease to say, but do you know that your father was so anti-vaccine, he could have survived if he was not selfish enough to refuse to be vaccinated and go and even spread false rumors. Today, we are laying him to rest. It's painful for us. Children become orphans for that. So for us, the only evidence that is there, it's the vaccine. And that's why we partnered with you immediately when the vaccines were open. We met with the prof, we came to University of Venda, and you welcome us, and we started vaccinating at the university. And we still continue even now because it's evidence-based, it's science that is talking. We're dealing with the novel virus. We've been able to win on that. We want the economy to go back to normal. And if we can vaccinate as many people, even December festive season will pass without having that. So I was telling other patients to say, when they say we are busy with the recovery plan of clearing the surgical backlog, we spend a week there in Venda district in the to operate patients who were waiting to be operated but couldn't because of the third wave. And I even asked even Human Rights Commission to say, what about the right of a woman with a breast cancer who, this woman, every time she goes and it's her turn to be operated or to go for radiation or oncology, she's told, we're dealing with the third wave, we can't attend to you. Doesn't she have a right? She goes and gets vaccinated, but she cannot be operated because we have, our wards are full of, our doctors are busy with COVID-19. And then when she must die of breast cancer because somebody is refusing to be vaccinated, we lock down the country for first, second wave and the third wave because we did not have vaccines. There are vaccines now. The country cannot be locked down. Country must not be locked down. We must not be told, don't attend to orthopedic cases, attend to COVID-19. Those who did not vaccinate, it's high time that they must understand, and they should not expect miracles from us. The miracle that we are having is to give them the vaccine. So we can win on this if we are to work together. So let me briefly deal with the psychological impact so that I can go towards my conclusion. The psychological impact that we have, I know there are experts who are going to talk about it, but just to remind, there are different type of people who, and the impact will be differently. For instance, starting with someone who's under investigation in the early stage, because it will take you 5 to 6 days to get the results. If you come to the hospital with symptoms being sick and we test you, waiting for the results, the trauma that you go through while you are waiting for the results, you know you've got pneumonia. You don't know whether it's bacterial or it's COVID-19 pneumonia. And that anxiety, that stress, when it kicks in, you even die of that stress and your results come out that you are negative. You are not COVID-19. So those are the people who were also, we needed to look at, to say, when someone waiting for the results, how do we then reassure them and be able to counsel them to say, even if you are positive, we need your immune system to be strong, and stress destroy your immune system. We also have got people who are admitted in ICU, confirmed COVID. They know the neighbor has died of COVID-19. They know, they've read, and they were watching the funeral of a minister on COVID-19. They ask themselves, I'm just a mine worker. I've got children. If doctors could not save a minister, if doctors could not save a doctor, a professor, who am I? That fear and that stress impact on them, and they have got negative outcome. I have patients that I think died because of this stress rather than COVID itself. So we needed to also find how to help them. They are worried that they are going to live dependent. What's going to happen to my children? Also, including myself, when I wake up every morning going to work, I was asking myself, if I get infected, what will happen to my 2 daughters? So it means everybody else. What about those who are infected already? And also the fear of infecting others, to say, I'm going to infect other people if or I have already infected them. And also the family members and friends who are contacts. You know, when we had one of the sports star in the province who came back from overseas and did not isolate, went to sports events, to schools, met with even high-profile people, and later on she tested positive. I can tell you that the province was just angry, wanting to kill. We had to go to schools, to all those sports activity, and I had to physically go there myself, reassure them, test them to say, no, they say, no, what if we are negative? It's still a window period. So the fear, when you hear that so-and-so has tested positive, and you were with that person last night, you were talking, because COVID-19, when we are talking, we never think that the other person has got the virus. So those are the people that we would look at, and that's why our psychological department was very, very busy. There might not have been those who are appearing on TV or on radio, but I can tell you, Limpopo unit that we established led by Professor Mulepo, our psychiatrist, comprising of psychologists, social workers in the department, all of them, their hands were full during COVID-19 because of this work. And also the bereaved family members have already spoken about those, and people who were traumatized by staying. This is where I also want you to do research for me, because we can't reach out to those. There are people who have been in ICU for over a month. They survived. But that impact of being in the ICU, because when they were breathing through ventilators and all that, it was difficult for them. Seeing the next door dying, seeing other people dying in the ward has got an impact. Being afraid of dying, you should look into that. And also the effect on children, that often children who may have to relocate, right now they don't know. I've already spoken about it. Depression of the children, and even now behavioral changes that we see amongst our children. We need to start working with the Department of Education and start to empower our educators to understand when a child begins to change the behavior, when you know that this child has been a normal child, this child has been an A+ student, all of a sudden the grades are regressing, child is no longer participating in sports. We've got to make intervention, because in this province, suicide amongst the teenagers, we have just released the stats by October. We already have over 59 committing suicide, and so many attempting suicide and surviving there in our facilities. So we need to work on that. And of course, we must also look at the impact on the frontline workers, where you're talking about your nurses, your doctors, your cleaners, your groundsmen, your police who were there throughout, your soldiers who were there. How do we help them? The psychological impact of a nurse. Every day when you wake up in the morning, you don't know if when you come back you'll be positive or not. The day you are there in the ward, you think you did not glove correctly, you did not dress correctly. It's got so much impact on you throughout your the sick leave that we had during that time, and depression, and also the post-traumatic disorder. Those are the areas that we are worried about. There another category that was neglected, which was our mortuary attendant. At the hospital, we at the government mortuary, we've been able to look into them and attend to them because we've got authority over them. But here where academia can come in, do some research looking at what this impact has on ordinary undertakers. Remember, these are not business owners. I'm just working at the undertaker. My job is to wash bodies. Washing bodies that I know have got COVID-19, whether wrapped or not, having to console family that are coming every day, same family member. I'm also a human being. And what is painful is that those who are working there in those private undertakers, they are taking jobs because it's a job. It's because you are unemployed, there are no jobs in this country. So we need to look into that, because the owner of the undertaker will not have resources to take them to go and get professional counseling and help. Those people also require to be really counseled, because many of them were worried that what if I got infected? Overexposure, and also dealing with death itself. And other people, your pastors. You know, I was talking to some pastors. One of the famous pastors from Ashamba village was known, contracted the virus and died. And many other pastors were now scared to say this virus can take our lives, because they will tell you they bury at 5 in the morning at 7 another death, at 9 another one, at 10 another one, at 12, and even in the afternoon at 5. The whole day they spend it at the graveyard. They will tell you they don't even have to go home. They must just sit and park there. So we need to really look into all those and assist them. And some of the manifestation of these psychological problems, which includes anxiety disorder, depression and suicide, PTSD, you have raised it, even including our students, psychotic disorder. And I know some people who have suffered, who are out of the ICU, they will tell you they do not remember most of the things. They are always forgetful. And the cognitive disorder, this I'm talking about the memory loss, where delirium, when people become confused as the oxygen level drop in the brain, and the memory loss that many people are talking about. And there would be the social impact, where people have lost their jobs because of COVID-19. They have lost family members. They are unable to visit their loved ones, because when you go into a third wave, we close the hospital. If you go to fourth wave, we do not allow many visitors in the hospitals. We close because we are protecting others, not because we are being funny as government. And also inability to go to church. Because one thing that we need to appreciate, both as academic and the government, is that the evidence is out there. Our people in South Africa are mostly religious. They believe in their churches. Now, when you close down the church, you are closing that pastor who will give a source of hope. Because the reality of the matter is, people who usually commit suicide, I know I've got many experts here in psychology, it's that you think, and you've got a low threshold in terms of problem solving. When you have lost your job, it's the end of it, and you don't know what else to do. So sometimes going to that pastor of yours, whether it's a false prophet or it's an apostle who's lying, the issue is they will give you hope to say, don't worry, we're going to pray for you, you're going to receive these miracles. You got that intervention, I can tell you, it's what I need. That intervention to be telling this person and give some source of hope, whether it's false hope or whatever. It's intervention, it buys time. And once you buy that time, that person is not going to commit suicide, and then we can come in and make intervention. That's why we work with these churches, all of them. We don't care whether it's charismatic, it's traditional churches. We need you, as long as you are a pastor with followers. We want to go into your church so that those who are doing wrong things, we can be able to sit and correct them. So for us, we do not get judgmental to all these institutions. We have seen pastors helping us a lot. So when you close that church, you closing that source of giving people hope for someone to go and be prayed for. So we also, there was issues of stigmas here, where people stigmatizing it, especially health workers. I remember our nurses who could not even use public transport because they are wearing epaulets. They had to take off the uniform because in the taxi, no one wants to talk to them, no one to sit next to them, because these people are having COVID. Some of them, towards the early stage, even at home, they were not allowed. At home, you must change your clothes when you enter the door. The child must put the gown, and then you change, you wear your gown, you go and shower. Then after that, your husband can talk to you, but won't sleep with you as long as you are working in the COVID-19. So these are critical issues that we really need to address, including the issues of the stigmatization. So the economic impact here, we must know that the social determinants of health include poverty, education, physical environment, access to health care, and social support. So these factors, they are also closely linked to social aspects of the community. Until we deal with poverty, education, and all that, the healthcare, these are the determinants of why you are a healthy nation or not. Even if our investors want to invest, they will look into this. And when they look at the health status and look at the life expectancy, we were coming all right, getting to 65 now, but then we've been regressed by COVID-19. Therefore, investors see that in this country, how do you invest when this country, it's not dealing with its social determinants of health? Therefore, the life expectancy of the people, it's very low. So we need to look into that. And I'm not going to dwell into all those social determinants of health. We all know them, that the freedom and discrimination of violence, the social inclusion, and all of them. And of course, the job losses that have been, we have experienced, issues of hospitality being the hardest hit, the tourism industry, our airlines not functioning, people working from home, remember, sporting fraternity. You must remember, when Lidoda Duba is playing with Chiefs there in Twando Stadium, for me, what was bleeding was Bonya Mukamadi, who is selling those chips and bananas and avocados and chisanyama at the stadium and paying school fees of their daughter with that money or their son. And when Chiefs and Pirates is no longer playing, it means Bonya Mukamadi does not have a source of income. And the 350 that we propose to give, some government employee take it, and they do not even have, because even if they have it, 350 to many of you here in this platform doesn't even buy your lunch. That is a fact we can't dispute. But for those people, that 350, it doesn't even do anything. So that is why we have seen what it has done to this particular industry, entertainment industry. For me, it was not necessarily about the sports players themselves. It was also about when there is a festival, people are making their own innovation to sell whatever and become to support their family. So this topic, Prof, is very broad, and if I am to talk about it, I will not finish the day. So the issue which we want to appreciate is that can we really work together towards assisting the economy? But of course, we are not job creators, but we can help government to come up with innovative ideas to make sure that we create conducive environment for business to thrive and the economy to grow. We are there as academics. We can be able to work, you can work with us to assist on this impact on our workers, the burnout, the fatigue, and the malaria that our employees continue to face on a daily basis. We can be able to work, and the intervention cannot only be done by Department of Health or Department of Social Development. I believe this is a good start. This is where we have started, and we must also have special consideration on children, people with a disability, mental health users, senior citizens, our older citizens, and women who are pregnant, those who are lactating, and also those who have been exposed to GBV, and also with immune system that has been. So for us, we must just remember that we have reached the time wherein we've got a solution, and the solution is the vaccine. And I know, because I'm talking to the relevant department, that understand when we introduce the vaccines, there will be the innovators. I always give an example that when iStore decide to announce that there will be a new iPhone, there will be those who are waiting for it to buy it. They will even sleep at the store itself, so that as soon as it's out there, they're the first one to buy. Those are innovators. They don't care whether what is happening, does it have the futures that they don't even research about it. So we've done, those are some of us, when the vaccine was there, we went and get vaccinated. Those are the people who didn't ask many questions. And we know we have got early adopters. Those adopters, they are opinion leaders. They are still questioning even today, why this vaccine, did it take less than 6 months to do it, instead of other vaccines that polio and measles have taken decades to be able to produce finally. And forgetting that coronavirus, it's a family of coronaviruses. So SARS-CoV-2, which is responsible for COVID-19, is just part of that family of coronavirus. And that SARS-CoV-2 virus, we had the SARS if I remember, whether it was in 2006, I can't remember exactly the year. We also have the MERS in 2012. These are families of coronavirus. All these viruses, when they were there, researchers were already started on the vaccines for coronavirus. So the mRNA vaccines, we are not starting them now today with these Pfizer vaccines. The work has been done. We also have got technology. In the past, when I was still a student, to get PCR test, you will need 3 weeks. But today, we need, in less than an hour, the PCR test is out there. Because of technology, we are living in a different world compared to when we were looking for the vaccine for polio or the vaccine for measles. So those high opinion leaders will be there. So we don't get impatient with them. There are also an early majority. Those ones will adopt a new idea before those an average citizen. We've already vaccinated those. And the late majority, these ones, we are currently now busy vaccinating them. And I know even with the students, in January, we will be vaccinating the late majority. These ones are waiting for their friends who have been vaccinated or they did not die. Or if basakofala, if angafangi, I'm not going to die. So we will vaccinate them. We know they are current, it's just that we don't have time. We are under pressure to deal with the fourth wave to find us having vaccinated admin. And of course, the last one are the laggards. Those ones, highly traditional, conservative, we understand them also. They might not even vaccinate. That's why we put a 70% target, because we know the laggards might not even agree to be vaccinated. I want to close by appreciating once more and remind us to say, since the Spanish flu pandemic in 1918, the world has not experienced a pandemic of this magnitude. More than 100 years later, that COVID-19 has unleashed globally. And of course, South Africa was the 5th hardest hit country in the world during the Spanish flu, with about 500,000 people dying by then. So the psychological, social, and economic effect will be felt for decades to come, as we are not yet even on the recovery period. Remember, we are still now focusing on the vaccine, so that once we get this thing of vaccine done, we can quickly focus on the recovery. Right now, COVID-19 gives us a breather. For instance, on Monday, as Limpopo, we are the only province which registered 0 cases. Most of our hospitals, almost all, are empty with, they are no longer having COVID-19. But this is short-lived. This virus, we don't know its intelligentsia. It gives you a breather and it comes back. So what is important is that people should remember, and they must always remember that lockdown regulations and social distance, hand sanitizing were put in place, and they will continue to be placed for a reason. And that it is the responsibility for all of us to prevent the infection and thus reduce the social and economic impact of this pandemic. When people lose jobs, they lose their medical insurance. If you colleagues here, I know in Limpopo, 91% of its population is dependent on the public health. Less than 9%. People, when they lose jobs, that 9% starts to come back to the public health. So it is not my interest or the interest of the health sector for people to lose their jobs when we go for lockdown. It's because we look at the lives and find they are more important. So that is why we're saying, let's all vaccinate and get back to normal. So spreading of this fake news, which fueling people to stop following all the protocols not to vaccinate, it's having a serious impact on the work that we are doing. And that, of course, mental health care services are there. We do have mental health care institutions to prevent the adverse psychosocial and economic effects of this pandemic. So let's work together, Prof, and let's work together with your team and come up with solutions that will be tailor-made for our province, Limpopo. And I can reassure you, even other provinces will come and benchmark. Throughout this pandemic, when we were vaccinating, they will come, we will share with them our experience on how best can they vaccinate. And we've seen them going back to implement the strategies that we have shared with them. And we came up with tailor-made strategies that talk to Limpopo. We think we can do this if we are to work together. And my apology for taking away your time. Unfortunately, you invited me on the topic that is very closer to my heart. Thank you very much. At the end of the day, our health remains our responsibility, not that of Ramathuba or Dr. Jopal, our responsibility as individuals. Thank you very much.
Thank you so much, MEC of Health, Limpopo Province, Dr. Poppy Ramathuba. Let's give a very big round of applause, colleagues. MEC, I think it's important to express appreciation for such a provocative address. And this is indeed real life situations that we have been sharing with us. And despite limited time, the MEC have been able to make us to be more wiser about matters pertaining to COVID-19 and its impact. And we are confident that our academics will continue conducting studies on COVID-19. Colleagues, Dr. Mukorosi has introduced our panelists, and I think it's worth indicating that each presenter has been allocated 15 minutes, and we have 5 presenters, and all these 5 presenters will conclude their presentations in about 1 hour, 15 minutes. So in the interest of time, let me invite the first presenter, who is Dr. Nontembe Kobila from the Department of Social Work and Criminology, University of Pretoria. Dr. Bila, over to you.
Good morning, colleagues, to the program director, the MEC, the VC, the executive team, the HOD, organizing committee, fellow panelists, the registrar, and the attendees. I want to greet you all and also convey the greetings from the Association of South African Social Work Education Institutions. So I just request the team, if you can just upload my presentation, please, from your side. As I'm just waiting for my presentation to be cited or to be uploaded, my topic that I'll be presenting about is COVID-19 impact on socio-economic and mental health aspects. This really taken me aback. I was in a memory lane where I was looking when the president addressed us in March, and he indicated that there will be a lockdown. I remember what came to my mind. I was really scared. I didn't know what is going to happen. I had fear. I had anxiety. Since that time, I've never been to the university. I'm working from home. As a result of that, COVID-19 has been labeled as a black swan event and is likened to the economic scene of World War II. Really, we see that this pandemic is unexpected, and the events that are happening are really ravaging the whole aspects of our lives. The mental health is really affected. The economics of our country are affected. Everyone from all walks of life are affected, but more importantly, when we look at people who are marginalized or low-income people, they are really affected. Looking at their jobs, the MEC really touched many aspects that I'm supposed to talk to. The issue of informal traders, they couldn't trade and they couldn't bring food on top of their tables during that time. People who are working as domestic workers, couldn't go and work during that time, and many of them lost income and livelihoods. And when we look at that time of the lockdown, we saw people panicking. Immediately when the president said, I'm locking down the country, we saw queues in many retail stores, people panicking, buying, stock piling. It was like that. And look at the people who was affected. Is the person who didn't have money during that time. They didn't even have money, and when they had that 350, they couldn't even, buy anything during that time. So it was really, really a challenge for them. So we saw that this has a long-term socio-economic impact. It really, really intensifies the financial inequalities, as the MEC alluded to. So we see this as a challenge for indefinite time. We don't know when are we going to say that we are back to normal. We don't know when are we going to recover. But as the MEC was indicating, there is hope at the end of the tunnel. So what I'm saying, I'm emphasizing the issue that despite whatever that is happening around us, we need to address the issue of coping strategies. We need to have mental health intervention, awareness, using the available resources. I'm happy that the MEC talked about their available resources, like mental health facilities that are there that can help us. So when we look at this issue, I'm focusing now on the impact on the socio-economic aspect. Indeed, the COVID-19 is a human tragedy, as I've just indicated. It has ravaged our economic state, and it's not us alone. Worldwide, people are really, really affected. So it has significant economic and social impact for short and long term. It has manifested through labor uncertainties. As we look at their winners, I look at that, I'll put their winners and also losers in this game that we are in. We saw essential services being able to flourish, but those that were not, like accommodation, restaurants, they were unable to function during that time. So we realized that the economic activities were impacted. So the societies and the economics were really, really affected at the core. So most likely, whatever that has happened, we saw many people, they closed doors. We saw that people that are unable to pay rent in the retail malls and the shopping centers, people have closed. And also, I was in Durban in an Asaswe conference. My heart bleed when we saw what has happened during the time of the unrest in KwaZulu-Natal and also in Gauteng. Those shops, it was in July whilst I was in Durban, they are closed. People that are forced to go far and get some essentials, whilst they were able to get essential within access and within accessibility in their places. So we saw this is really, really affecting us, whatever is happening. So people who are really, really at the brunt of this are people who are vulnerable. You can move the slide. I'm talking to mental health now. As we look at mental health, I just really, really, when we look at that, it has three components. Emotional, we want to be happy. We want to be satisfied in life. As VC talked to, we have our celebrations, we have our rituals that we couldn't even, when a person is getting married, the whole nation will be there and celebrating with that person. But during this time, it's only 50 people. And mind you, this is also causing enemies within families. Because if I don't attend the wedding, why me? Why I'm not chosen? Because I'm not important. So the psychological well-being, we have purpose in life. We have realization. And we need to be, to feel that goodness. So during this time, mental and emotional well-being have been affected by the imbalances that are caused by multiple dimensions that are particular in untoward circumstances like the COVID-19. You can move the slide. So we've seen the pandemic, as the MEC was alluding to, the increased levels of anxiety, depression, suicide behaviors. I heard that whilst the MEC was presenting, she indicated that there's an increase in the suicide of youth in the province. So really, there's something that has changed. There's a shift that has happened in our country. We saw as well, whilst people were in lockdown, there was the increased use of substances like alcohol. If you still remember, the shebeens, the taverns, and all those were closed, but we saw people making home-brewed, concoctions, and then we had that other people passed on due to those concoctions that were made. So basically, that's that. In this slide, I'm talking to the arising sort of impacts within that are direct and indirect. I won't talk much to this because the MEC has touched all these aspects. The issue when you are diagnosed, or the issue whilst you are waiting for your results, the anxiety that you have, the issue of bereavement that we lost many people. You know, I think in the second wave, like January, people were passing on. When you are in the social media, you'll be seeing the RIPs. You know, as a result, I was scared also to just go to social media because it's RIPs of people that I know. You can pass this slide because the MEC has touched it more. So I also focus on the interface of socio-economic and mental health. We know it from long that poverty and mental health, they've been realized that there is a link there. So really, the COVID-19 has showed us these disparities that have occurred between poverty and mental health. The person who is really affected is the person who doesn't have, is the person with low socio-economic. As well, there's an increase as well of mental health problems to the people who are living in a low socio-economic status. We also talk about the social gradient. When we talk about this, it means that mental health problems are more common further down the social ladder. Therefore, COVID-19 affects vulnerable people more than those from high income status. So let's move on. I want to zoom in to the issues of COVID within our spirit. Unfortunately, I'm in that space. I just want to cite an example. I gave students sort of a task. I said, let's do self-reflective mental health, journals. The messages that I got when I was reading, my tears were dropping. The students are really affected by COVID-19. You find that you are at home and the parents, they expect you to do house chores. This one student wrote in her self-reflection, indicating that I'm fighting with my parents because they don't understand why I don't do house chores. As a result, that student failed for the first semester. And mind you, she has a sponsor, and the sponsor indicated that we are going to withdraw our sponsor. Can you see that? So indeed, this has affected preschoolers until to the tertiary, the closure, while the courses are moving to the online, and you can see the state that we are in now. We can't be able, others, they don't even have Wi-Fi's, but they were help whilst they were in the residence. At home, there's nothing. As the MEC was talking about the issue of the urban and also the informal settlements, the students that are in the informal settlements, they're really hit hard by this COVID-19. The students are experiencing their mental health and emotional well-being. They can't cope, during this time. The students feel that the lockdown has difficulties in their academic and feel isolated. that they can't, have those groups. I remember again to cite, to make a context, I gave them a group assignment. Most of the students, they indicated and say, ma'am, we don't know one another. How are we going to work? So I had to devise some means so that these students can be able to meet. Because if they were in the campus, they were going to organize and be able to meet. You can pass the next slide, please. So the female students are really, really affected. Those who are doing, their first years and also residing in informal and rural settlements. That's why I was single out this one girl that indicated, because as a female in a household, you are expected to be working whilst you are at home. You cannot just be given a plate, you need to work. So students are really, really affected. So, and another issue is that the students are not in person in classes. It has a greatest impact on their satisfaction. Most of the students, they say you can do whatever with this online, but we didn't sign for an online. We are not a corresponding, university. We sign in and we pay that. We want to be on the face-to-face, we understand the issue of hybrid, but it's not, fulfilling us. So the online learning has impacted so much on the student lives and hence the overall of the university experience. As a result, I was marking assignments. I realized that there's a lot of plagiarism and among students. I'm sure many of you will attest to that. So let me zoom in again and come here to us as university staff members. We are really, really affected. And this issue of mental health has been reported long time ago, that as university staff members, we have poor mental health, status, and it has escalated more during the pandemic. So there are factors that are there. If you don't publish, you perish. So there's this contestation amongst us universities. We want to be in the highest rank. So now we are really, really affected. The work-related stress, high workload, often unattainable performance evaluation, because we are unable to go to the conferences. Even if we write, we don't have that enthusiasm that we used to have. The competition that I was talking about in academia, the contracts, others are not fully employed. They are so frustrated. Is my contract going to be reviewed? The sudden demand of adjustment to online. We know that we've got different generations. Other people, they are not glued up with this technology. People are really, really affected. They're so frustrated. And also working from home, it has another ball game. I can talk for myself. I'm working until 2 a.m. because I feel that I don't reach whatever target that I'm supposed to do. And it's affecting me at the end. I have fatigue. I'm so tired. Also looking at the screen, it has affected me. You can pass. So the university, I talked to the issues of uncertainty, fatigue, and then reopening generation, new feelings of uncertainty. Can you see, next year we might be going back. We've been used to be working from home. Now there will be another shift that is happening. So the concerns have been raised regarding the number of scientific conferences that have been cancelled or postponed. We know that's where we network, we collaborate with our, international partners and all that, but that has been cancelled. Okay, I fully agree that we have online, but they don't have that flavor, that human flavor that we want. So that has really, really affected us as in academia. We can move. So now I'm looking at what can be done then. What needs to happen? So what I say is that we need to have a resilient and strong leadership in healthcare, business, government, and wider society is required. Immediate relief measures need to be implemented and adjusted to those that may fall through the threats. Medium and long-term planning is needed to rebalance and re-energize the economy following the pandemic. I heard the MEC talking about those recovery plans that are in place. So we really plead, if there is money that is meant for people who are vulnerable, as the MEC was indicating, heart was touched. The people who, the haves, are still taking from the have-nots. It's really, really not on. A broad socio-economic development plan, including plan and an ecosystem that encourages entrepreneurship. I think we need to focus more on that one. It is prudent that the government constantly reassess and reevaluate the state of play and ensure that whatever is promised is truly delivered. Whatever the MEC was talking about, we are opening our hands. We need that to be delivered, whatever that is promised. So the infrastructure for socio-economic and the whole government mental health recovery plan should take cognizance. Let's move on. Universities should give special attention and support to high-risk students. Online peer counseling and group support should be supported during this time of crisis. Psychoeducation on coping strategies, health benefits, and physical exercises. You know, because we're sitting most of the time, and if we don't take care of that, we'll be affected. So together with online exercise and training programs, adequate physical self-care could be offered to students and wrap around services to promote academic resilience. Faculties should consider providing additional academic support in the form of tutorial videos by lecturers with question and answers, session and asynchronous digital classroom, allowing for flexible to the benefit of both lecturers and students. We really, really applaud the universities because now we've got Blackboard, others they call it in different, we call it ClickUp in my universities, in my university. So those need to be fast-tracked, and the infrastructure of data should be provided. Additional tutors could assist in creating learning communities where senior students help students to adapt to online learning and building academic resilience. Students who experience adverse emotional difficulties, they can be housed in the university residence. Move on. So for the staff, what I'm saying, guidelines on setting up a safe, healthy, and functional workstation at home. Can you see we're working at home? Like now, my laptop is not working. There's load shedding. I don't have data. You know, it's just frustrating. So they need to be sort of service support that is given to staff. And also communication, overflow of communication, clear and timely communication of contingency plan for the personal safety and work conditions should reach staff to do their tasks successfully. Technical support for the capacitation of staff to get their work on the online platform. Line managers should alter about workload, skills development, and ability of staff members to do their tasks successfully. You know what I'm encouraging? Many people, some, they didn't even learn. They use slides or those old, projectors. Now, shifting is a challenge, so capacitation should take place. Human resource and employee wellness program must be aimed at vulnerable groups to inform them about the function support system. Information leaflets and education materials can be disseminated to create awareness about symptoms of mental health problems among staff. As I indicated initially, long poor mental health has been diagnosed among staff. So continuous efforts to build the resilience of staff cannot be underestimated. Mental wellness can be mitigated, the effects of the pandemic on the mental health of the staff members. Take home message, let's embrace the new normal. We do not know when the pandemic will vanish. COVID-19 might be with us for a long period. Let's take care of our mental health. Let's build resilience. Let's continue adhering to the protocols, wearing our mask, sanitizing, social distancing, and washing our hands regularly. And finally, I know that many people, they're hesitant to go and vaccinate. Let's go and vaccinate. Thank you. the last slide, I think I'm done. And then I've said everything, the questions if they're there, and also I've set all the references that I've used for this presentation. Thank you so much. I'm done with my presentation.
Thank you so much, Dr. Bila. And let me remind colleagues that a provision has been made on the program for questions and answers. So I would like to remind participants to note questions and comments for individual presenters. These questions will be entertained during the session of questions and answers. So thank you so much once again, Dr. Bila. Let's move to the next presenter, with Ms. Zambia Lorraine Bam, a PhD candidate from the University of Cape Town. Ms. Bam, over to you.
Honorable MEC, Executive of Univenda, the panelists and students, good morning. I have to state from the onset that I'm load-shedded and I'll have to run through my presentation in the interest of time also. Well, worldwide, disasters and emergencies had often had an impact on people with disabilities, and this pandemic was no exception. This pandemic, for me, had a triple jeopardy for persons with disabilities. There was an increased risk of poor outcome. Hello? There was an increased risk of poor outcome from the disease because of the existing medical problems that persons with disabilities had had. The second jeopardy was the reduced access to routine healthcare and rehabilitation. And this was caused by the cancellation of daily routines, which are therapeutic for persons with disabilities. And the third jeopardy was the advanced social impact and efforts to mitigate.
My apologies, Ms. Bila. May I remind colleagues to mute your mics if you are not speaking, please. Go ahead, Ms. Bila. I'm sorry for that.
Okay. Along with its high infectivity and fatality rates caused by COVID-19, we all had the universal psychosocial impact, economic burden, and financial losses. But this was worse off to people with disabilities, and I'll explain it as I go on. There was the impact of COVID-19 to right to health to persons with disabilities. The planning phase of the lockdown in South Africa, it was not properly managed. The lockdown had to be implemented, but the measures that were taken by government meant that persons with disabilities were worst off and excluded. For example, several research studies undertaken on people with autism indicate that walking relieves them of anxiety. And during the heavy lockdown, they couldn't do so. Secondly, people with intellectual disabilities living in residential facilities, they had a higher risk of death to the pandemic, depression, than people without disabilities, because whenever a person with a disability, intellectual disability, their routine is disturbed, it causes a lot of effects. The lockdown and the curfew which was enforced was aggressive by security forces in South Africa. Persons with disabilities who needed access to medical care facilities could not do so. The cancellation and postponement of this had a different impact which resulted in more anxiety, depression. Another example that I would like to give today are individuals who are expected to use masks and physical distance. People with hearing loss who could not lip read, or people with visual impairments, or people who use guide dogs find it difficult to follow these rules. And as a result, they felt stigmatized. And this had a psychological impact alone. You have a disability, there's stigma that has already been there. Then there's the pandemic itself. Additionally, confinement in homes, the risk of physical violence and abuse to children with disabilities also posed a psychological effect. The inadequate preparedness was shocking when it comes to education, which is where students with disabilities digital readiness for students with disabilities. I can argue and say no. Most students with disabilities have got special needs. When you go home, how do you access a Braille learning? When you go home, how do you have a sign language interpreter to go with you online and listen for you and sign for you? This was not available. Students were faced with countless barriers, as I've said. Some even didn't have access to remote learning to ensure that their softwares were available, including a provision of things like JAWS and talking systems. What needed to be done, as I said, I'll run through we needed to develop accessible and adaptable material for students with disability to support remote learning, to develop accessible education and audio materials to disseminate through different medias, online, educational programs, but also with the assistance of sign language interpreters. We're moving towards blended learning. Are students with disabilities ready? Have the appropriate assistive devices been provided, which will include sign language interpreters, JAWS? The second part was the socio-economic impact of people with disabilities. Most people with disabilities, we know, they work in NGOs. The 5% that we've been looking for has not been achieved in South Africa. Most people who work in NGOs during this pandemic, which are people with disabilities, NGOs have closed down. There has been no special financial provision which has been made for persons with disabilities who work in NGOs. What needs to be the suggestions that I'm providing? I know I'm not audible enough. We needed the suggestions to provide financial aid for persons with disability to add any source of income. The grant itself is not enough. And number two, the 350 that was offered to people with other people did not apply to persons with disabilities because of the grant, of which the grant doesn't absolutely provide you with all your basic needs. There needs to be, you need to provide a financial compensation for self-employed persons who find themselves with no income. The government needed to implement financial assistance programs for persons with disabilities who stopped working or to prevent a contamination of family members using the very same disability grant because now they are also unemployed. My computer is saying 1%. Allow me to say, let me conclude by saying, for dealing with these psychosocial issues and the society and for dealing with these psychosocial issues which were created by the pandemic, we needed crisis intervention to be urgently developed by government and the health personnel. We needed a psychological preparedness to be set up by mental health organization post the pandemic. take back students who have been left behind. Allow me to say, time has come for rights of students, because I'm speaking to a forum whereby they are academics. Time has come for the silent voices of students with disabilities to be heard. And that needs a transformational agenda, which needs to be driven by the VC and the disability unit at Venda. Nobody needs to be left behind, because some of the students with disabilities have already deregistered because remote learning was not accessible to them. They are used of coming to classrooms where they will find Braille material. There's a disability unit that would do Braille material. They have sign language interpreters. That was not there when they were at home. And as a result, they needed, all the information they needed was not available. As a result, they deregistered. How do we go back and say we help them? What is the transformational agenda of the University of Venda towards those students? In that transformational agenda towards the blended learning that we're always looking forward, that we're all looking forward to, there's also an issue that some persons with disabilities, because of other existing ailments that they have, they are reluctant to be vaccinated. What is the role that the university will play in making sure that students with disabilities are not left behind? With 1% left on my MacBook, I would like to say nothing about students with disabilities without them. Let no student with a disability be left behind, and let the silent voices of students with disabilities during and post this pandemic be heard, because it will only take education to drive students out of to drive persons with disabilities out of the SASSA database. And education will allow them to become allow them to be economically active. They need to be kicked out of the SASSA database, and that will only be done by helping them with all that is needed: sign language interpreters, audio, JAWS, and all the other assistive devices that they may need. I thank you.
Thank you so much, Ms. Bam, for the presentation. Colleagues, without any further waste of time, let me invite the next presenter, Professor Puleng Sekgalo, Chief Albert Luthuli Research Chair, University of South Africa. Professor Sekgalo, over to you.
Thank you very much, Program Director. Colleagues, good morning. Thank you very much for the opportunity to provide a few words this morning. I'm trying to share my screen, but I think there's someone else also sharing their screen, so I'm not sure whether, okay. All right. Thank you very much once again for the opportunity. I would just like to start by echoing the MEC when she said that our nation is not a healthy nation, both physically and psychologically. And I believe that this is really a pertinent issue for us to really consider as we continue experiencing and navigating the world in this time of COVID. COVID-19 has accentuated the continent's socio-economic inequalities, and among those previously oppressed by both colonial and apartheid states. The inequalities we experience as a result of this past remain to this day. The glaring disparities became more apparent when our governments promulgated the COVID-19 regulations and recommendations from public health campaigns. For instance, as citizens, we were urged to regularly wash our hands with soap and running water or use hand sanitizers. And this flies in the face of the poor and those trapped in the rural areas, those whose lives represent the glaring structural inequalities entrenched through apartheid and colonialism policies. For many of these communities, access to running water is a luxury. Water is reserved for bathing, for cooking, and for drinking. And another recommendation which was provided by the government and health campaign was the need for the consistent wearing of masks, which is very important, as we know, to assist us so that we do not contract the COVID-19. However, for some people, this presented another challenge, especially for the vulnerable and poor, because on average, a face mask reportedly costs around 10 Rand, which highlights again the affordability factor. And another challenge that disadvantaged African communities is the idea of having to wrestle with the idea of social distancing. And as you can see here, for many people who are living in informal settlement, this becomes a challenge. Many people in many of our Black communities live in informal settlements or RDP houses. In such circumstances, as we saw during COVID-19, it became impossible to maintain social distancing when already pre-COVID-19 space had been an issue for many of our people. So again, as the MEC said, we can look at COVID-19 as a wake-up call for the work that needs to be done, the work that was already needing to happen in many of our communities, but then oftentimes they get glossed over, or it takes a long time for change to happen. But what COVID-19 has done was to really lay bare and hyper-visibilize some of the challenges that we are already experiencing as a nation. A plethora of literature demonstrates that globally, people have been embattled with varied epidemics and pandemics that threatened the lives of the population and their livelihoods for decades. And COVID-19, therefore, is no different. However, COVID-19 presents a unique feature that sets it apart from other historical pandemics that have specifically plagued African nations. What sets it apart is the prevailing and glaring inequalities and gendered and racial disparities that continue to confront us as a nation. Colonialism has left an enduring, oppressive, and unequal legacy on the African continent. And following colonialism, Africa's most marginalized groups continue to feel the remnants of the glaring inequalities of this oppressive system that has led to class, race, and gender injustices. When governments of different countries introduced and imposed lockdowns and their restrictions to curb the devastating impacts of COVID-19, technology was hailed as a core instrument of continuing life's activities while the world was at a standstill. And Dr. Bila alluded to issues related to technology. And also, again, people with disability, as Ms. Zambia has said, have also experienced a number of challenges when it comes to technology. Technology allowed people to continue their work commitments, students to continue their academic activities, and businesses encouraged their customers to shop online as preventative measures for infection. Others were able to stay in touch with their families using their mobile devices to observe the social distance regulation. Sadly, however, this was not the case for millions of people who do not possess the privilege to easy access to smartphones and the internet. Many of the disadvantaged within African communities are often African women, for whom the offline space isolated them from the economic, political, and social spaces. Thus, it is critical to engage the digital divide that the virus has accentuated. COVID-19 has augmented and mirrored the disparities and access barriers rooted in our society. According to the Association for Progressive Communications, these economic and social disparities will deepen in the future if not given attention they deserve. We already see with some of the students who are struggling to access their reading material, and now during exam time, we are inundated with many students sending emails requesting for extension or special exams, because when they were supposed to upload their portfolios and do their exams from home, many of them experienced challenges with technology. And of course, another unique challenge that we have now in South Africa is the issue of load shedding, which is affecting the ways in which we do our work. This is also affecting students when they have to be busy with their exams. And this adds on to the anxiety and stress that students are experiencing. Individuals who lack access to the internet become isolated and their vulnerability becomes heightened. This also obstructs their chances of accessing public health information and services. Limited access, if at all, to the internet may exacerbate people's strained negotiations of gender and sexuality in an already unequal patriarchal terrains. Given these insights, women, girls, and other marginalized people, such as people with disabilities, are confronted with a bleak reality of not realizing their human rights both on and offline. And with this brief background on the myriad ways in which COVID has affected various parts of our lives, I would like to turn to focus specifically on African traditions and rituals and how these have been affected by COVID-19. In particular, I would like to focus on the African mourning practices. African people go through various coping mechanisms to deal with the pain of losing their loved ones. Given grieving is a necessary healing process for dealing with the loss of loved ones. And for healing to occur, it is necessary for the grieving person to be afforded the opportunity to draw on coping mechanisms during death and burial processes. Healing mechanisms include a journey of finding meaning, which is also essential for helping the grieving person or people to overcome the misery of loss. The challenge, however, is that during a pandemic such as COVID-19, these coping mechanisms get interrupted, thereby hindering the healing process of the grieving persons. COVID reshaped the processes that people adopt when it comes to mourning the loss of a loved one. There are numerous activities surrounding the death of a loved one among many of our African communities, but restrictions that were imposed as a result of the pandemic affected how these could be actualized. For example, viewing the body of the deceased became a challenge during the pandemic, specifically the body of the individual who died of COVID-19. One of the COVID-19 regulations in South Africa is that the body of the deceased is to be handled by a specific undertaker and wrapped in a bag and labeled as a COVID-19 dead body. Although family members are permitted to view the body of the deceased in the mortuary, they are not allowed to touch it. Further restrictions were imposed on people with respiratory systems as they were not allowed at all. The challenge to viewing the body, the dead body, should also be understood in the context of the restrictions of the number of people who could attend the funeral. During the hard lockdown, this number was limited to 50, as the VC also reminded us at the beginning. This limit of the number of people who could be a part of the burial process meant that many people did not get the opportunity to pay their last respects. The after-funeral gatherings, such as the after tears, were also not permitted during the hard lockdown. These after tears gatherings are perceived by some people as a form of a healing ritual where people gather together after the burial of a loved one to reminisce and collectively remember the life of the deceased. In many African contexts, the grieving process involves the performing of various healing rituals. These rituals around death and burial have become key cultural practices in many of our African contexts. For example, in West African countries such as Ghana and Nigeria, bodies of the deceased are kept in the mortuaries for many weeks while the family is busy preparing for burial in observance of various healing rituals. The connection between the spirit world and the world of the living happens through the various rituals and ceremonies, including the burial ceremonies. Many of our societies cope with grief around the loss of a loved one through these burial rituals and ceremonies. The COVID-19 pandemic flipped the script on how these invented patterned ways, or the ways in which we grieve and bury people, and the rituals that accompany them are conducted in our communities. The lockdown and its regulations prevented people from being able to mourn collectively or hold night vigils to spend the night in the company of the deceased. And as Kenham argues, COVID-19 has disrupted community and ritual. In its place is an incredible loneliness where custom is replaced by regulation. These disrupted rituals are crucial for people in various communities as they assist with their grieving processes. The coronavirus regulations of viewing the dead body of a person has created complications when it comes to performing rituals, as I said. African bereavement rituals render death a broadly dialectical process of shepherding the deceased soul through a series of embodied rituals performed on or involving the bodies of both the deceased and the bereaved, and spiritual rituals which steward the deceased soul to an ancestral spiritual realm. However, with the advent of COVID-19, it became difficult for communities to show solidarity with one another after the death of loved ones. Social interaction was limited, and this might have contributed to the prolonging of the process of bereavement. So we continue to live in communities where people are experiencing perpetual bereavement as they never had spaces to hold and spaces to support each other through their bereavement processes. The process of showing solidarity with the bereaved is aimed at ensuring that people have support and a space to mourn with both the family members and the community at their side, since the loss does not only affect the family, but the society at large. For many of us, the process of grieving and mourning the death of a loved one is also perceived as a political act where there is an insistence on acknowledging the life of the deceased, their memory, and also their dignity. For a people, African people, whose humanity has been negated for a very long time, there is a need for us to create avenues that allow for the dignified embracing of a life. And in many ways, COVID-19 has taken this away from us. Whether dead or alive, and African rituals are very central as they allow for this dignity when we lose people. We need to acknowledge that grief happens at the physical, at the cultural, at the psychological, and at the spiritual level. It is therefore pertinent to take seriously how all these dimensions intersect and influence the mourning and healing process of the bereaved. We need to see mourning as a humanizing pathway. So when we are denied the ability to mourn, then part of our humanity gets taken away as well. Through comforting those who grieve, we come to face our own vulnerabilities and also incomplete mourning. As we comfort other people, we are also comforted as well. As we further reflect on the process of incomplete mourning, we ask a number of questions. What happens to the many people who have had to bury their loved ones without seeing their bodies one last time? How are the wounds of loss to heal when the process of viewing the body, which acts as a salving process, is not allowed because of the pandemic? These are critical questions to reflect on as we reconfigure life in general going forward, but also as we reimagine the burial processes more specifically. We need to embark on a project of healing. That when we do not heal, that when we do not grieve or mourn properly, then we may be left with mental health challenges that are going to affect other aspects of our lives. We continue to be a nation that has unresolved traumas of the past, challenges that we experienced during apartheid. And with COVID-19, these unresolved traumas, again now with the loss of many of our family members, manifest in our society, and it may lead to a diseased society where we may see violence and abuse of each other or abuse of substances, and us feeling disconnected as a people. So we need to forge solidarities. We need to create spaces of reflection. We need to take a moment to show care for one another. In the academic institutions, as colleagues supporting each other, acknowledging that people have experienced loss of loved ones, and therefore be gentle in how we engage with each other in these spaces. At the same time, acknowledging the losses that many of our students have experienced, the loss of parents, the loss of siblings, the loss of relatives, and create spaces to also acknowledge the need for healing for our students and find ways in which we can support our students. Create space so that the scars that we carry as a people can be healed. And this can be done if we allow spaces for grieving, spaces for mourning, that when a colleague is not feeling well, when a colleague has lost their loved one, that a week off from their work environment, that the report that maybe was due can be submitted later on, or that we can come together in solidarity to say, I will do that report on your behalf while you mourn, while you heal. In that way, colleagues, then we show our humanity. Then we can be able to allow space for grieving to happen so that healing can be happening as well, that beyond COVID-19, we can have a society that is not heavily affected by the traumas that would have been left by COVID-19. And with these few thoughts, colleagues, I would like to thank you for your attention. Thank you very much.
Thank you so much, Professor. Hello. Colleagues, we have two more presentations to go. And let me once again remind colleagues to note questions which will be entertained after the last presentation. So on that note, let me invite Mr. Victor Mabidura, Limpopo Provincial Manager, Human Rights Commission. Mr. Mabidura, over to you.
Thank you very much, Program Director. Our thinking here that maybe I should not go through everything page by page on the slide, because I think I can see that the time allocated is not that much sufficient, but I'll try my best to summarize my presentation. In fact, thank you very much once more. I think this topic is very much crucial, it's very much important. And obviously, when we talk about the pandemic, this pandemic have also had a very serious impact on the enjoyment of human rights in the country. So it also created a massive work to the